Jenny. I'm your nurse today, and I'm going to be doing assessment of your thoracic cavity, your heart, and your abdomen, okay?
Mm-hmm.
So first I'm just going to inspect and look and see what I'm looking at. The skin is tan and symmetric on both sides. The hair pattern is even and consistent with the male distribution of hair. There's no lesions or macules present. There is pulsation noted. And his respirations are even and unlabored. Now I'm just going to feel. Are you feeling any pain?
No.
Okay. There's no pain, no thrives, no heaves, no bulges, no abnormal lesions noted. So now I'm going to take a look at the back of your lungs. And what I'm going to do is test for tactile fremitus. So every time you feel the base of my hands on your chest, I want you to say 99, okay?
Mm-hmm.
All right, go.
99, 99, 99, 99, 99.
And tactile fremitus is noted with symmetric vibrations. Next, I'm going to test symmetric expansion. I'm going to test it at the 10th rib. So what I need you to do is take a deep breath in and out. Good. And breaths are symmetric. Next, I'm just going to percuss, so you can just breathe normally, okay?
All right.
Good. Next, I'm going to test for diaphragmatic excursion. So what I need you to do is cross your arms and lean forward for me. And what I need you to do is exhale. Okay. And I need you to inhale. And this is consistent with 3 to 5 centimeters, which would be known as normal. All right, you can sit up straight for me. Next, what I'm going to do is listen to your lungs, okay?
Okay.
Take a nice deep breath in. Good. Out. And you can just continue in and out as you feel the stethoscope move. Good. I'm just going to turn your chair around here, and I'm just going to listen to the front of your lungs, and the same thing. Good. The lungs are clear with even breaths, and there's no adventitious lung sounds. Next, I'm going to look at your heart. So first, I'm just going to inspect. Again, there's even respirations and pulsations noted. The base, the border, and the apex are all palpable. There's no murmurs felt, and the PMI is palpable. Okay, so what I'm going to need you to do is to lay down so I can listen to all the different areas of your heart. Okay. Alrighty, so first we're going to listen to that PMI again, which is also known as the mitral valve. So we're going to come down to the fifth intercostal space, midclavicular. And then we're going to come up to the fourth space, which is the tricuspid. To the third space, which is Erb's point. To the second space, which is the pulmonic. And to the second right space, which is known as the aortic. Good. S1 and S2 are both heard. S3 and S4 were not heard. There was not a murmur heard. S2 was primarily heard in the aortic and the pulmonic, and S1 primarily in the mitral valve area. Okay, next we're going to check your pulses. So first I'm going to be checking your temporal, your brachial. Keep your arms straight for me. And your radial. Good. Can you bend, uncross your legs and lift your knees up for me? We're going to be checking the dorsalis pedis, the tibial, and behind the knees. All pulses are strong and smooth. No abnormalities noted with those. Okay, lastly, sir, I'm going to be assessing your abdomen, okay?
Okay.
Okay. If we look down at the abdomen, it looks round and symmetric. There's no lesions or macules noted. The umbilicus is inverted, not showing any signs of colon sign. We can tell that there are even and unlabored respirations and pulsations noted. Okay, I'm going to take a listen to your belly first, okay?
Okay.
Good. And vowel sounds are present in all four quadrants, ranging from 5 to 30 as a rate, which is normal. Next, I'm going to listen to your organs to make sure there's no friction rub. So first we'll start with the liver. And the spleen. Good. No friction rubs noted. And lastly, I'm going to listen to your arteries. There's 4 arteries we're going to listen to. I'm going to use the bell of my stethoscope to do this. We're going to be listening to the abdominal aorta, the renal, the iliac, and the femoral, which would be located down here. Any pain or discomfort when doing that?
No.
Okay, good. Next, we are going to percuss. I'm going to percuss your liver and your spleen, and then we're going to palpate, okay?
Okay.
All right. So first we're going to start with the liver, and I'm going to be making some markings on you. So we'll be going from tympani to dull. And then from resonance at the fourth intercostal space to dull. And if we measure, this is 7 centimeters, which lies within the normal range. We'll go over to the spleen, which we should feel resonance in the intercostal margin and dullness in the intercostal space. The spleen is not palpable, and that is something that is normal, but we can palpate the liver and the renal arteries. So I'm going to come under here. Are you feeling any pain?
No.
Okay. Go ahead and take a deep breath in and cough. Any pain?
No.
Good. The spleen is soft and smooth. There's no rigidity noted, no calcifications noted. And I'm just going to palpate your kidneys, which lie retroperitoneal. Any pain?
No.
Good. Okay, we are done with your assessment. Thank you.
Thank you.